Hi, my name is Tanya Duncan, and today I'm going to stress the importance of early intervention and prevention for mental health and give you the opportunity to support it. Now, let me know. I have children in my family who suffer from mental health disorders and have seen firsthand the positive effects that early intervention has on children with mental health issues and how it improves their quality of life and overall well being. Imagine a classroom where 1 out of every 6 children is silently struggling with a mental, behavioral, or developmental disorder. According to the CDC, this is the reality for children aged 2 and 8 in the United States. The prevalence of mental health disorders in children is influenced by a complex set of factors. Genetic predisposition plays a significant role, as children with family history of mental health issues are more likely to experience similar challenges. Environmental stressors such as exposure to trauma, abuse, or neglect can significantly impact a children's mental well-being, often leading to the development of disorders like anxiety or depression. Socioeconomic factors also contribute, with children from lower income families facing higher risks due to limited access to mental health resources and increased exposure to stressful living conditions. Additionally, educational pressures and social dynamics within schools, such as bullying or peer pressure or rejection, can exacerbate mental health issues in children. These factors, when combined, create a complex web of influences that contribute to the increasing prevalence of mental health disorders in young populations. Mental health disorders in children are more common than we think. Left untreated, they can lead to severe consequences such as academic failure, social isolation, and increased risk of substance abuse and suicide. According to Early Intervention in Youth Mental Health, Progress and Future Directions by Patrick D. McGorry and Christina Mei, poor service utilization during this development period is alarming, given that effective early management is key, not only for preventing the progression of mental disorders, but also for reducing the mortality and long-term morbidity so often associated with these disorders, including premature death, social isolation, poor functioning, and reduced educational and vocational productivity. Timing of intervention is critical to prevent these adverse outcomes and the enrichment of symptoms. Young people typically demonstrate a need for care prior to reaching the threshold for traditional major psychiatric diagnosis where distress, functional impairment, and warning signs or microphenotypes of mental illness are present, making early intervention at this time point crucial for preventing or reducing the severity of a full threshold disorder, macrophenotypes. Therefore, ensuring that all children with mental, behavioral, or developmental disorders receive early and appropriate intervention, it will lead to significant improvements in their academic and social outcomes. Make a mental picture and visualize a world in which every child has access to mental health care and the needs are being met. Early intervention can result in improved academic performance, healthier relationships, and a better future. Schools would transform into nurturing environments where mental health takes precedence, and our community's mental health awareness and programs will lead to resilient community with prioritized mental health and overall well-being. On the other hand, if we don't take action, the repercussions will be severe and negatively impact children today. Children will continue to suffer silently, and their issues will progress into adulthood. The societal impact will be overwhelming, leading to increased rates of crime, homelessness, and substance abuse. The cycle of neglect and the stigma will continue, leaving generations of children without vital help they need. Addressing mental health with an integrative and multifaceted approach has several benefits, such as more personalized care, better communication skills, coping skills, improved mood, holistic healing by considering mental, physical, social, and environmental factors, preventative focus, which often emphasizes early intervention and prevention, which can reduce severity of mental health issues over time. According to What is Integrative Health in Mental Health by GCU, counselors work closely with clients to help them overcome a wide range of challenges. While taking a whole person collaborative approach, a mental health counselor may do any of the following: evaluate clients' mental, physical, social, emotional, environmental, and cognitive wellness. Reach out to clients' other healthcare providers to share information and collaborate on treatment plans. Help clients develop strong skills, coping skills, positive thought, and behavioral patterns. Work with clients' families to educate them about their loved ones' challenges and discuss how best to support the client. Refer clients to community support resources ranging from support groups to housing assistance to job placement services and beyond. Future outcomes from addressing mental health with an integrative and multifaceted approach can be transformative, leading to long-lasting positive effects on individuals and a society as a whole. The approach can result in enhanced long-term well-being, improved academic and social outcomes, a decrease in societal cost, increase to access to care, and the development of stronger community resilience. According to Prevention and Early Intervention in Youth Mental Health, it is time for a multidisciplinary and trans-diagnostic model for care. Mental health is a key component of a person's ability to function well in their personal and social life, as well as adopt strategies to cope with life events. In this regard, early childhood years are highly important in light of the greater sensitivity and vulnerability of early brain development, which may have long-lasting effects on academic, social, emotional, and behavioral achievements in adulthood. In this high prevalence indicates the urgent need for greater awareness, support, and resources for children dealing with these challenges and the responsibility we all share in addressing this issue. The information I have shared highlights the prevalence of mental, behavioral, and development disorders in children, stressing the importance of early intervention to prevent long-term adverse outcomes and how we can improve academic and social well-being. I have emphasized the need for a greater awareness, support, and resources for children dealing with mental health challenges to ensure the children in our communities can receive help and get their needs met. The potential positive impact of an integrative and multifaceted approach has children's well-being and mental health is great, resulting in improved emotional resilience and overall quality of life. This sets the precedent, emphasizing the critical importance of early interventions and preventions in early childhood years for long-lasting positive effects on various aspects of life. Now is the time to act. I encourage you to stand up for our children's mental health and spread the word and raise awareness. If you're willing to take a stand, please raise your hand, and we can begin to promote healthy lifestyles and better overall mental health and well-being. Today, I have a list of resources for mental health crisis from Mental Health America, including 988 and a disaster distress helpline and a crisis text line. Also, if you are in need of help, just grab your phone and dial 988. That is a lifeline for you. If you are in a mental health crisis, dial 988 and they will help you. By taking and encouraging responsibility, we can share the goal of addressing children's mental health issues, encourage sense of duty, and promote others to engage in solutions and support efforts. Together, we can make a real difference in our lives, in our children, and our community. Thank you for your attention and your support. I have listed my sites in the comments below.